Hello there.
Hi.
Hi, my name's Dr. Batty. I'm one of the medical doctors on the stroke ward. I'm looking after Michael at the moment. Can I just confirm your name, please?
Louise Simmons.
And are you the next of kin of Michael?
Yes, I'm his daughter.
Okay, thank you for coming in today. I understand you wanted to speak to me a little bit more about Michael's care on the ward, is that right?
Yeah, well, this is the first opportunity I've had to get here and be able to speak to somebody about it.
Okay, so tell me a little bit about what you know already and what's been going on from your point of view.
Obviously, I'm aware that he's had quite a major stroke, but other than that, I'm not sure what treatment he's had or what the situation is.
Yeah. Okay. Well, thank you for coming in, and what I hope to do today is talk you through what's been going on whilst Michael's been in hospital, but also to think about the next steps going forward as well. So you're quite right in that Dad has had quite a big stroke, and you might have seen him already. It's affecting one side of his body such that he's got a significant amount of weakness on that side. And because of the extent of the stroke, it's affecting some of the functions that the brain would normally help with. So, for example, his swallow and his speech. And those are things that he's not able to control himself at the moment. And so we're sort of helping him with those functions. So we're giving him some nutrition and medications through a tube in his nose going into his stomach. And then also having the physiotherapy team to see him on a daily basis to try and strengthen his muscles and try and improve his mobility as much as possible.
Yes, I did notice that he'd got the tube.
Yeah. That's right. And as I mentioned, that's to give him medicines, but also to provide him with nutrition. So we have speech and language therapy team and also dietitians, and they have advised for this as kind of an interim measure whilst his own swallow ability is impaired, so that he gets ongoing nutrition essentially.
Right, yes.
Okay. So, you did mention that you were told he's had a major stroke, and that's quite right. It has caused a significant amount of damage in the brain, I'm afraid.
Right. So is he, how aware is he? I've not had a chance to speak to him yet.
Yeah. So at this moment in time, he isn't fully aware of what's happening around him. And therefore it's very helpful for us to speak to you about any wishes that he would want in a situation where he's unable to express his own wishes, but nonetheless we don't think he's in pain or in any distress at the moment.
Oh, but that's good to know.
Yeah. And we will be assessing. We see him daily on the ward rounds, and obviously our nursing team can let us know if they're concerned about him in any way as well. So does that sort of make sense so far in terms of where we're up to?
Yes, it does, yeah.
Okay. So I think what's really helpful to talk about is kind of where we go from here moving forward. And as I alluded to earlier, the stroke has affected a large part of his brain. It's very, very severe. And unfortunately, the damage that has been sustained as a result of that is irreversible.
Right.
So when we think about going forwards, we start thinking about prognosis and what degree of recovery we might be able to expect in this situation. Yeah. And I'm really sorry to say that at this stage, it looks like the prognosis may be very poor because of the extent of the stroke.
He's always, I know he had his problems with his diabetes and his high blood pressure, but he's such an independent person. To think that that's potentially been taken away from him, I don't know that he will manage not having that same amount of independence anymore.
Yeah, no, of course. I mean, you've seen him as an independent person, and now he's obviously very dependent on us for medications, for physiotherapy, and it's a life-changing event that has happened to him and your family as well. And I'm sorry that you're kind of going through this. It must be very, very difficult. Yeah. So because you're here and we appreciate that we're able to get some input from you, I think what would be really helpful is if you could share with us, perhaps, if you're aware whether Dad would have any wishes at a point in time where maybe he's not able to express his own wishes. So, if he were to deteriorate further, is there something that Dad would want or Dad wouldn't want at that stage?
Well, I mean, if that were the case, then, no, like I said, I think he would struggle not having that independence that he's had in the past. So,
okay.
So I'm not quite sure what you're alluding to.
Sure. So in these situations, it's really helpful for us to think about something called resuscitation. Is that something that you've heard of or come across in the past?
Do you mean like a what do they call it, a do not resuscitate order or whatever?
Have you heard of that before?
Yes, my auntie had one.
Okay. And what's your experience of that?
Well, I don't know much around it, but I know that she was incredibly poorly.
Yeah. Okay. So what we often do in hospital is when someone comes in, if they're well or unwell, we think about what would happen if they were to deteriorate further. And if they were to deteriorate to such a point that their heart stopped beating or they stopped breathing and they had died, what treatments would be appropriate at that point?
Mm-hmm.
And sometimes we can offer things like electric shocks to the heart or compressions to the chest to try and bring that person back to life. But that's not always the most appropriate thing to do. And sometimes allowing a natural death and a more dignified death is more appropriate.
I don't feel that that's the right decision here.
Okay, and what's driving that? What are you thinking at the moment?
I don't know. I know I said my dad would struggle, but it seems a bit extreme.
Yeah, and I think, you've seen him so independent, as you said, and it can be very, very difficult to have these conversations and think about your loved one in that way. Ultimately, this is a decision that we make as a medical team, and we try to think about what is likely to be in the best interest of this person. So normally we would have these conversations with someone who's able to engage in the conversations and tell us their prior wishes. But whilst Dad is not able to do that, we have these conversations with the relatives and the next of kin. Now, because of the extent of the stroke and the fact that this is now not reversible, we feel that if Dad were to get to the point such that his heart stopped beating or he stopped breathing, then that would likely represent the end of a natural dying process for him. Performing resuscitation and measures to bring him back, like compressions on the chest or electric shocks, would not prevent death and would potentially cause more harm through rib fractures or further brain damage, and that would impair quality of life even further.
I appreciate what you're saying. Is it possible to get a second opinion?
Yeah, of course. So with all these conversations, they're very difficult, and the decisions are very difficult. So I've had this discussion with my consultant already, but of course we can ask for another opinion from another senior colleague, and I can certainly arrange that for you, if that would be something you would appreciate.
I just think with what you're saying to me, I just feel like I need to hear from somebody else.
Sure.
What you're telling me as well,
Yeah, no, of course, I completely understand that, and we can arrange that for you. I think what I would like to kind of emphasise here is that this discussion and this decision it only refers to the event of what we call a cardiac arrest or a respiratory arrest, i.e. the heart stops beating or he stops breathing. It doesn't impact the care that we currently give him, so we will continue to ensure that he has his physiotherapy, that he gets the medications he needs to treat the stroke, that he gets nutrition, fluids, any potential antibiotics or oxygen that he might need. So all those things we would continue to offer him, and we hope that he will start to recover, maybe slowly, but we hope he will. But this is the decision that we've spoken about only refers to that stage of if he were to stop breathing and his heart stopped beating.
I understand.
Yeah. Okay, any further questions at this stage then?
No, I don't have any.
Okay, fine.
The candidate should begin by establishing what the family member already knows about the patient's admission and exploring their concerns. In doing this, the candidate will be able to identify that the family member has not been updated since admission and should therefore proceed to provide a brief summary about this rather than immediately discussing resuscitation. The candidate should provide an overview of the care that the patient has received so far in the hospital, as well as explain the severity of the patient's current condition and the prognosis going forwards. When specific concerns are raised surrounding specific aspects of the patient's care, for example, the need for nasogastric feeding, concerns about medications on discharge, and support that is currently lacking at home that will be required, the candidate should acknowledge these and attempt to address them by providing reassurance and explanations. The candidate must explain the guarded prognosis, in this case clearly, and this is often a useful way to begin discussions surrounding resuscitation. In the first instance, it is worth exploring the family member's understanding of the term resuscitation and whether they or their loved one has ever previously had any views on resuscitation. The candidate should explain what resuscitation is and what a do not resuscitation order entails. They should also clearly explain a do not resuscitate order will not negatively impact on other aspects of their father's care. For example, provision of antibiotics, fluids, analgesia, and other treatments required to prevent deterioration. A good candidate will explain that resuscitation involves chest compressions and delivering electric shocks across the chest in order to restart a heart that has already stopped. If the reason the patient's heart has stopped is the end result of a natural dying process, then this is unlikely to be successful and may cause harm, including rib fractures, punctured lungs, and brain injury. When the heart stops in these cases, resuscitation does not prevent death and will prolong suffering. In the case of this patient, if they were to become more unwell, given their comorbidities and prognosis, it is likely that their heart stopping will be the end stage of a natural dying process, and therefore attempts at resuscitation will not be in their interest. It is important that the candidate explains that resuscitation decisions are primarily a medical decision made to prevent harm and suffering. In this case, the patient does not have capacity, which is why this discussion is being had with the family member. The candidate should ensure that the family member understands what they're explaining throughout, answer any questions, and is sensitive to their concerns and views at all times. They should understand that this can be a distressing conversation and that the family members may require time to digest all the information that is being given.